The UK government's handling of the pandemic has been widely criticised, with the death toll likely to pass 100,000 in the coming days. But its vaccination program has been a rare success. More than 6.5 million Brits have now received their first jab, or around 10% of the UK population. Our chief international correspondent, Ben Lewis, has visited a mass vaccination hub in the city of Salisbury in England's south to see what lessons Australia can learn from the British rollout.
It's been closed to the public throughout the pandemic, but the people of Salisbury are making a pilgrimage to the city's cathedral, not seeking a miracle, but to receive a medical marvel, the COVID-19 vaccine.
We've prayed here every day throughout the pandemic for the healing of the world and for the protection of our people. And now we're able to make a contribution to that happening.
The 800-year-old building is now a vaccination hub.
When you break it down to the nuts and bolts of it, actually the large spaces, high ceilings, good ventilation mean that it's perfect.
More than 1,000 people a day are receiving the jab at this local landmark.
I'm ashamed of myself. I was born in Salisbury and I've lived here all my life and I've never been in here. I did think it might collapse on me, as I came in the door, but it didn't.
For 87-year-old Dorothy, the appointment was a rare day out.
I've been indoors now on my own because my husband's died, and, well, ever since last March. So, it'd be nice to go out and about and see my family.
While supply hasn't been a major issue so far, that's due in part to the government's policy of delaying second doses of the Pfizer vaccine beyond the recommended 3-week interval, which could present problems in the coming months.
I think that is certainly going to be a challenge, getting 10 to 12 weeks for us here, getting the second dose out and making sure that other cohorts are all fully vaccinated. That is definitely a challenge.
But one the team here is confident of meeting. This is what the public sees: doctors, nurses and volunteers doing extraordinary work. But the real secret to Britain's vaccination program is behind the scenes. Thousands of people working in management, community outreach and logistics. The UK's track and trace system, largely outsourced to private companies, has been somewhat ineffective. But the vaccine rollout has been led by the National Health Service, utilising the local knowledge of GPs and public health professionals. And because nearly all British residents are registered with a local practice, prioritising and contacting patients has been relatively straightforward. Most receive appointments with a few days' notice.
Well, my sister had hers the week before, and I was so envious. It's not, it's like, oh, crikey, I haven't got mine. And then it came, so we got really excited about that, and this is it, we're here.
The vast majority of Brits will be vaccinated in slightly less spectacular surroundings: a convention centre, a hospital or a local GP clinic. The variety is by design.
So long as we've got maximising the use of the vaccine available and getting it out there, I think that's the absolute key, however that happens.
Of course, few sites come with a 19th century organ.
It's a fantastic way to get some live music to people after a really long silence.
It's a quirky setup, but it works. By putting vaccine hubs in churches, mosques, sports arenas and cinemas, the UK should come close to reaching its goal of vaccinating the 15 million most vulnerable by mid-February. Hallelujah, indeed. In Salisbury, Ben Lewis, SBS World News.